In every hospital, nurses and doctors have to round on their patients to ensure timely care and update them on their care plan. In the same way, we are rounding on our different clinics and units in the hospital and around our community to keep you, our community, in the know and up to date on what's going on in Hillsdale Hospital and how you can access your local healthcare. So today we are in the Wound Clinic, otherwise known as the Center for Wound Care and Advanced Hyperbaric Medicine. We're excited to kind of show you around today, introduce you to some key team members who are a part of this clinic. So let's first of all go and meet Heather at the check-in part. So here we are on the third floor of the hospital. So once you come up to the third floor, you're just going to take a right over here to meet Heather at our check-in. Hi, Heather.
Hi, welcome to Wound Care.
Thank you. Thank you so much for being on the video. Can you talk a little bit about what the process is for someone who's checking in as a patient before they see a provider in the clinic?
Yeah, sure, absolutely. So you would just come up here to the third floor, like you said, come into the office. I would greet you. We would verify your, identity, make sure, you're the right person and all of that stuff. Just verify some information with you, make sure that we have correct name, address, phone number, all of those things.
And what does a patient need to bring with them?
So when you first come to the wound care on your first visit, it's very important that you bring identification, your insurance cards, so that way we can take a copy, and as well as like a medication list. That's very important for the nursing staff that you have that. So
and how do patients make appointments before they come here? Is it only referrals from providers? How do they kind of get to the point where they have an appointment?
You don't always have to have a referral. It is helpful because then our nursing staff and our providers know what you're being seen for ahead of time. That kind of helps them. But you would just call up here to us. You can either call the main hospital number or we do have a direct line.
And then do you talk to those patients initially?
Yes, I talk to everyone first.
And then what are you trying to find out? Are you trying to find out about the wounds, something like that?
Yeah, so when I first talked to you, I would definitely ask about, the wounds, what you're being seen for, kind of getting that background. Also, a lot of times I'll ask questions like, who is your primary care physician? Because if your insurance does require, some sort of something from them, that's helpful to be able to contact them ahead of time before your first visit. I will ask about your insurance.
So that you're all set to go once you get here. So lastly, what kinds of insurances do we accept?
So we accept pretty much everything. I've not ever had one that I know of say, no, we're not covering you. So there's the typical Medicare, Medicaid, any of the branches of those, most all commercial insurances. We do also work with the VA, so you can be seen here for that also.
Well, thank you so much, Heather. I know that you're such an important part of this process and our patients love you. So thank you so much.
You're welcome.
We are here in the wound clinic now with Brad. Thank you, Brad, for joining us. Can you introduce yourself?
Yes, Brad Hodshire. I'm the program director here at the Wound Care Clinic.
Great. Tell us a little bit about the wound clinic. How did it start? Why is it here? And what does it do for patients?
So it started because it's a need in the community, and you have to go an hour away now for wound care, especially to see a provider and to have the advanced modalities as we do. So
yeah, definitely. Great. So let's talk through some of the indications, some of the different symptoms that a patient might have, and what the process is once they get here to the wound clinic. So first of all, when should a patient think, okay, this wound has gotten to this point, I should call the wound clinic?
Right. Really, at any time, if you see a wound starting, just make a call. Either if you see a doctor, they can send a referral or they can self-refer.
Because it's easiest to treat it the early on in the process.
Yes.
So let's talk about, I know there were 7 steps of wound healing. Can you talk through those?
Yep. So number 1 is blood flow. If you don't have blood flow, you're not going to heal.
How do you test that?
So it's called an ABI. And it's a blood pressure cuff on each ankle and on your arm. And it kind of gives an accurate description of, do I have good blood flow? If you don't, we'll send a vascular. If you do, we can move on with other interventions.
So Dr. Long kind of gets involved a little bit. That's great. So then what's step 2?
Step 2 is infection. So when the patient's here, we'll do a culture. So we'll see if there grows any bacteria. So start them on antibiotics if needed.
And step 3?
3 would be debridement. So the patient's in there, they come in. If it's called slough on top. It's like bacteria, a film.
Is that kind of like a scab or something like that?
It's more
not
like
quite.
It's icky, gooey, whatever that you want to call it. Exudate.
Gotcha.
So it's there, and it's like bacteria, making a little house for itself.
Great.
So we scrape that off. We'll numb first, and then scrape. We want it to bleed a little bit to bring that nutrients to the surface.
That makes sense. So should a patient be trying something like that at home?
No.
I didn't think so.
No.
So they should always come in for something like that.
Yes.
Is for certain wounds, would you stop there and say, okay, it might heal on its own?
We like to see it till closure.
Okay.
So no matter what, even if we're not doing a surgical debridement, we can do what's called a mechanical, where we scrape it.
Okay. Yeah.
So, yeah.
Okay. So what's the next step?
The next one would be nutrition. So those, especially those diabetic patients, we'll have, check their A1C if they haven't recently.
Yeah.
If it's anything greater, we can send to a dietitian.
Yeah.
So that's
great.
Make sure that's good.
Yeah. Yeah. Because I mean, even just the food that they eat and the kinds of vitamins that they're getting really plays a role. I'm assuming.
Yeah. Oh, big role. Yeah.
Okay. Great. And then after nutrition, after that. Okay. So what is that?
If the patient has, let's say, a wound on their foot, on the bottom of their foot, we don't want them standing on it. Right,
oh, I see.
Just putting that pressure on, limiting all the, the circulation.
And especially if it's numb, they probably don't feel.
Exactly. With neuropathy.
Okay.
Absolutely.
Yeah. Okay.
And even in pressure ulcers, so if they have them on their bottom or on their hips, wherever, doing that Q2 turn, make sure they're off it for an amount of time. Yeah.
Okay. Okay. So if a patient is wheelchair bound or bed bound or something like that, then you kind of go through that process. Okay.
Right.
So if a patient is walking around, but you want them to get off that foot, if it is a foot injury, would you assign maybe crutches or wheelchair or something like that?
Air boots. To take the pressure off, and we have it's called a TCC. It's a total contact cast.
Yeah.
So they'll come in weekly for that.
Okay. And then what store do we use to supply those things?
The medical supply here.
Oh, great. Hillsville Medical Supply.
Great. Everything from there.
Awesome. So it's all local. It's all Hillsville Hospital. That's wonderful to hear. And then what comes next after offloading?
Hose factors, so different bandages. So if we have there's multiple different bandages we can use, especially if it's draining a lot, we can use, let's say Aquacel, for instance.
Okay.
It's got silver in it, or we can get the one that doesn't. It's the one with silver is antimicrobial, so it'll help keep bacteria out.
Oh, okay.
And then it helps wick away the exudate.
Do patients need to change that kind of dressing themselves at a regular basis?
Yep.
What are kind of the instructions for that? Is that a difficult process to learn, or can they have a family member help out?
If they can, a family member can.
Okay.
And we've had where they don't have family, so they come back multiple times a week.
Okay, and you could just take care of that here. That's great. That's really great. Okay, and then final process.
The final one is our advanced modalities. So we got hyperbarics and skin substitutes.
Okay, so we're going to talk about hyperbarics in a minute, but let's talk about skin substitutes. When is that really called for, and what is that? What are they made out of?
So there's different stages. So 30 days of standard care. We want to make sure they're healing. If they haven't healed 40% or greater, that's when we start looking at, we'll go through the 7 steps again. Did we miss something? Do we need to do something again?
Yeah.
And then no, everything's good. They're just stalled. They're not healing. Then we can go ahead and apply for a skin substitute. So we'll send the stuff to the insurance, and they'll say yes, we can.
And why does that help?
The skin substitute.
Yeah.
It helps. Like a lot of our natural skin healing, it's in the skin sub. So when you put that on there, it's just helping the process.
Okay. And what are those skin substitutes made out of?
There's different types. One, for instance, is like placental.
Okay. Wow.
They actually get so the mom and baby, they follow them all the way through, and they make sure that everything's safe. And then it's tested afterwards, and
wow. Okay. And are there different animals that you might take
There's like
from?
porcine. Yep. There's fish.
Oh wow. Okay. Great.
That's awesome.
Well, that's amazing that we have access to that advanced care here. So great. Well, thank you so much. I appreciate you being on here. I'm going to ask you one more question. To the patient who might be maybe starting to see a wound or starting to get concerned about something, they're just not sure, what would you say to them?
It's better to be proactive and just call. And it's not going to hurt to come in and be seen.
Yeah.
If they have any questions, just give us a call.
Great. Thank you so much, Fred.
Awesome. Thank you.
Foot and ankle health is an absolutely essential part of providing wound care to our community. And that's why we have Dr. Patel here. Welcome, Dr. Patel. Thank you so much for being back on video with us. We appreciate it. Can you introduce yourself to our viewers who have not met you yet?
Yeah, of course. Well, thanks for having me again. I am Dr. Komal Patel, and I'm the podiatrist at the Hillsdale Hospital. I spent some time at the Wound Care Center as well.
Yeah.
So that's where we are going to talk about wound care and how important it is for foot health.
Yeah. So your main clinic home is over at 3 Meadows at the Hillsdale Podiatry office, but every Tuesday morning, our patients could find you here in the wound clinic. And why is that? Why do you need to spend time here in the wound clinic?
That's a great question. Patients who are diabetics, many of them who has neuropathy, they can end up developing diabetic ulcers.
Okay.
And it's very important that we close follow up those patients with diabetic ulcer at the wound care center because we have a lot more resources and more dressing changes in case if they need skin grafts and things like that. We can do it here at the wound care center because it's more specialized.
Okay. So when might you send someone from the podiatry office over here to the wound clinic? When does that kind of happen?
It happens if a patient shows up with a wound that is significantly deep and bigger in size and it's not healing within appropriate timeline, which for me is about 4 weeks, then I would send them to the wound care center for more closer follow-ups.
Okay. And then, so anyone who comes into the wound center who the wound is on their feet or on their ankle, they're going to see you.
Correct.
Okay.
As well as legs too. I also see legs below knee.
Okay.
Yeah.
And I'm assuming that I know with diabetes, the circulation can't always get there, and that's kind of where the problem starts. Can you talk about that and talk about neuropathy and what that is and kind of the symptoms that might lead someone with diabetes to end up here in this clinic?
Yeah. So, diabetes is a disease that affects not just, a specific organ. It affects everything, right? That also includes skin condition, vascular as well, and nerves from the neuropathy.
Absolutely.
When patients are uncontrolled diabetic, a lot of them would end up having some sort of vascular disease where not enough blood is getting to their toes or feet or legs.
Yeah.
And that is also part why they don't heal as fast enough.
Okay.
Yeah. So vascular health is very, very important. And for that, we have a really good vascular surgeon around here, Dr. Alam.
Dr. Alam.
Yeah, he takes care of all of my patients with any sort of vascular issues or venous issues.
Okay, so the circulation isn't getting to that part of the body. Why does that impact wounds? How does that work?
Good, because it's not bringing good question I made. It's not bringing enough new blood cells, healthier cells to bring it to the wound to promote healing.
Okay.
And that's why those wounds don't heal on appropriate time.
Okay.
The longer time the wound stays open to the environment, higher chances for it to become infected.
Oh, okay.
So that's very important that we want to, tackle these wounds as soon as possible, heal these wounds as soon as possible, close them before they get infected. If they get infected, the infection can be localized to the skin. We can treat it with antibiotics and local wound care, aggressive follow-ups and debridements and things like that at the wound care center. But if the infection goes in their bone, then that's a separate big problem where they could end up needing an amputation depending on the level of infection, where it is.
And that's what you're trying to avoid.
Correct.
Yes. Only last resort.
Yes.
So let's talk a little bit about what the courses of treatment are. So we have HBO here. When might you think, okay, this patient is a good candidate for hyperbaric oxygen treatment, which we will kind of talk about more in depth in a minute. And then what are some of the other treatments that you do, and how do you equip patients to take care of their wounds at home as well?
Okay. So I'll touch on the type of wounds that I usually see at the wound care center. Diabetic wounds are obviously the big ones, where they can have wound on their feet or even ankles, as well as venous ulcers, where they have very heavy swollen legs, so a lot of fluid in their legs that can open up the skin around it, and as a result you have an ulcer on big ones on your legs.
If a patient with venous legs, if they don't have an ulcer yet, but they know that something's wrong with their legs and they feel like that might be the issue, should they come anyway?
They should definitely not to the wound care center. I would say they can start with
your office.
Yes. Okay. To my office, they can start with their primary care doctors as well, and then depending on how their condition is, the severity of it, we can help them with managing the fluids and things like that.
So diabetic feet, venous legs, anything else that would end up here?
Arterial ulcers are also big, where that's where the blood flow comes in. If they don't have good blood flow, if they're not diabetic, they can have severe peripheral arterial disease, which happens to those patients who are heavy smokers. Tobacco use and things like that, where their arteries are plaqued up in their legs.
So
and
it affects more than your lungs. It's your arteries.
All the arteries, right? In your body.
Which affects everything.
Yes.
Wow. Okay. So that's hugely significant.
Yeah, mainly the lower extremities, because further from your heart.
Okay. Yeah. Okay. So what kind of qualifies a patient to be in a hyperbaric chamber and receive healing that way?
Yes, I have recommended few patients for hyperbaric oxygen treatment. The patients who have diabetic foot ulcers or any other ulcers, who has osteomyelitis, they can which is a bone infection.
Just for the viewers, I know, obviously.
Yes, which is a bone infection. Depending on their insurance and the treatment they have had in past, and failure of those treatment can qualify for them to do an HBO and certain amount of dives. Depending, again, it varies how many dives. Sabrina will touch on that. I have referred some of those patients where, for instance, they have an ulcer on their heel and it's there for a long time now. They have chronic osteomyelitis of their calcaneus, which is the heel bone, a foundation of us walking and standing and things like that.
So just for the layman like me who doesn't fully understand everything. So if there's an infection in the bone, that just gets worse over time as the patient is walking around, using it, maybe not treating it with medical treatment, and it gets worse.
Correct. I mean, if it's not treated, then yes. Okay. Yeah, definitely. You could have, when you have an osteomyelitis that goes untreated and it becomes acutely infected, that can make patient very sick.
How do you kind of identify that infection?
So if it's acutely infected, there will be clinical signs of infection, redness around the wound, swelling, drainage, pussy yellow drainage, smell. Smell. And a lot of the time patients do not feel good overall. So they could have nausea, vomiting, fever, chills, and things like that. That's bad.
And they might not even really register that it's coming from this wound.
It does happen sometimes because sometimes they don't even know if they have a wound unless someone else notices or they see blood on the floor while walking because of that neuropathy, which they don't feel. So it's very important that this patient, again, check their feet every day or have somebody else check them.
So neuropathy, can you define that for us?
It is a loss of sensation at the bottom of our feet. And that can happen, not just diabetes is number one cause that can happen, but there's other factors that can lead to neuropathy. Few of them coming in my mind is certain vitamin deficiencies can cause neuropathy, certain autoimmune diseases can cause neuropathy, alcohol, heavy use of alcohol can cause neuropathy, but diabetes is like number one.
And it's usually a symptom of something else.
Right. You should. Sometimes, yes. And there have been times that unknown etiologies of why do you have neuropathy.
So it's kind of a numbness, it's like kind of a tingling, like when your foot falls asleep, kind of like that.
Yep, exactly what it is.
And it might decrease your chances of feeling pain if there is a wound.
It definitely, if you have a neuropathy, which you can't feel your feet at all. And sometimes when that happens, patients are definitely putting a lot more pressure when they walk on it, so they will stumble and stomp their feet. And that can lead to fractures. Weaker bones.
Wow. Especially if it's infected.
Or if it wasn't infected, and if it's the neuropathy is significantly.
So you want to catch all of this as soon as possible. Obviously, because it can get much worse over time. So how, if a patient is coming to see you, maybe once in a while as they need to, how would you recommend taking care of wounds and things like that at home in between visits?
Yes. So here at the wound care center, I usually see them once a week, that's why it's a very close monitoring of their wound, because it is sensitive, right? It is a body part that is open to an environment that we don't want it to be open to. So they see me very, very often. In between the visit, if they feel comfortable or their loved one who is accompanying them, usually somebody does come with them. They would help, change the dressing every other day or every day, depending on the need of the wound itself. Or they could come here at the wound care center every, twice or 3 times a week and get their wound changed.
Gotcha. Okay. Well, thank you so much, Dr. Patel. There's a lot of information, but just I don't know what we would do without you. Our patients are so grateful to you. We hear such wonderful things about the care you provide. I know that you also are in our surgical center all the time, and of course at your podiatry office. So thank you for treating so many wounds with such excellent care. We're going to talk to hyperbaric oxygen next and learn more about how that might help treat some of these conditions.
Perfect. Thank you so much for having me.
Absolutely. Now we are here with Sabrina. Thank you so much for joining us, Sabrina. We're going to check out the hyperbaric oxygen chamber and what that process is like. But first, Sabrina, will you introduce yourself?
Hi, I'm Sabrina Panage, nurse practitioner in the wound care clinic. One of my primary roles is to make sure people are medically appropriate and healthy enough to engage in hyperbaric oxygen treatment.
Perfect. And you're often the one who actually orders the treatment for a patient. So just briefly touch on what is kind of the sign to you that a patient's wound might benefit from this kind of treatment?
So if you have a diabetic ulcer that has a deep abscess or bone infection, that would be a reason to bring you into our chamber. Also, if you have a wound that has developed because it's not getting good blood flow, that would be a reason to bring you into our chamber. And then if you have like injury to your bladder or colon that's causing internal wounds and you're having a lot of bleeding that would be related to like past cancer treatment, then that would be a reason to bring you into the treatment.
Okay, so you might order it if a patient comes in as a self-referral, and then Dr. Patel, our podiatrist, who we just spoke to, she might order it for a patient, or Dr. March might order it. So a variety of providers might kind of get you here, but then Sabrina's going to take care of you with your treatment, and then of course our wonderful techs as well. So let's go in and check out a chamber. So Sabrina, tell us a little bit about how this works. What is the medical process behind it? And Arlene here is going to pull out the bed as we talk.
So when you go into a hyperbaric oxygen chamber, we are pressurizing the oxygen molecules so that with each breath you are able to breathe in more oxygen, bringing more oxygen into your blood flow, which then helps to bring more oxygen to your tissues where you may have a wound. And when we bring in more oxygen, there are certain bacteria that cannot survive in a high oxygen environment, so that will kill those bacteria. Also, your body is able to sense that suddenly there's more oxygen and the wound is not getting as much oxygen. So then it'll start to drive the creation of new blood vessel development to get that extra oxygen and blood flow to the wound, which if you're on antibiotics helps to bring more to the wound site, and then also just having more blood flow then starts to grow more tissue so that we can heal the wound.
Okay. So I know that there's a lot of different kind of off-brand versions of this, but this is clinically approved, evidence-based medicine, correct?
Correct.
Absolutely. So let's talk a little bit about the process of getting a patient ready for HVO. So maybe they've gone through the assessments, they're ready to get in the chamber. What needs to happen before they go in?
So before you go in, we need to make sure that it is safe for you to be in the chamber because you are in a 100% oxygen-rich environment, and oxygen can be flammable. We don't want anything in there that would be an additional risk for fire. So we have to make sure you haven't put on any lotions or perfumes, or that you have your hearing aids in that might have a battery. We're also very protective of our chambers. We don't want the chamber to get damaged in any way because that would be an additional risk for the patient. So we don't want you to have eyeglasses on or contacts.
Okay. What about a patient with like a pacemaker? Would that make them ineligible for this?
Nope. We figure out which pacemaker that you have, and then we keep a record of every type of pacemaker that has gone into our chambers, and then we know that yes, it is safe to dive. The same would be true for like a continuous glucose monitor.
So we call it diving. Can you explain why?
We call it diving because the science of this was developed from scuba divers, and some of the symptoms that we would see them develop after they came to the surface, or some of the things that we would just see like spontaneously resolve or improve because they were diving.
So because, they call it the bends, that's kind of like a sudden change in the pressure, the oxygen. And what is the percentage of oxygen in the normal air that we breathe compared to this?
So right now we're breathing 21% oxygen, and in the chamber, getting 100% oxygen. Sometimes we do air breaks just because too much oxygen could be a bad thing too. So for like 5 to 10 minutes, we'd have you just breathe 21% oxygen in the chamber.
So a patient looking at this might feel a little bit intimidating because it is kind of a tight space. Let's talk about claustrophobia and what we kind of do to help a patient feel more comfortable.
So most of our patients actually say because it is a glass chamber, that when they're worried about claustrophobia, it ends up not being as bad as they thought that it was going to be. And Jamie, our tech, is always sitting right here too, so that's kind of comforting and assuring. And you can talk on the phone. However, if all of that doesn't ease your mind, we can use anti-anxiety medications before you get into the chamber to help you to be calmer, maybe help you sleep through your treatment. We also have a TV to help distract you.
That's great. So. That's wonderful. And there is actually a phone inside the chamber.
Kind of. So the phone is out here, and then the sound just gets pumped in, and then we can hear you talking.
That's great. So you can still communicate and everything, very low pressure. If something for some reason feels wrong or is going wrong, that we can resolve that right away. So that's wonderful to hear. So lastly, just tell me a little bit about what you see as results. What do you see when a patient has a wound, comes in here, gets this treatment? What is the end result among most of your patients?
So we see the wounds start to heal faster because we're getting that blood flow and we're killing those infections and we're growing new tissue. Our patients who dive because of their cancer wounds internally report relief for their symptoms, and I've been told I got my life back.
Wow. Yeah, because there's a lot that having a wounds like that, even if it's internal, can really impede your daily life.
Yes.
And I know that we've talked to patients who are just in so much pain sometimes, and treatment like this can make a difference. So for patients who are prescribed this treatment, how often do they normally have to do it, and for how long?
So it's a daily treatment Monday through Friday for 2 to 2.5 hours for 1 to 2 months, depending on the diagnosis and your progress.
That's a big time commitment.
Yes.
So how do we work with people who are worried about spending that much time here, maybe taking time off work, things like that?
So we dive people from 8 to 3 was about when we would end, 3:30. So we try to work in if you need to come before work or after work or a partial day. We filled out FMLA paperwork if that's been needed.
Yeah. Okay, great. Thank you so much for joining us for today's Hospital Rounds video. I really hope that our community is enjoying this series. Please let us know which unit or center you want us to round on next, so we can keep spreading the word about what's going on at Hillsdale Hospital and the care that you have access to right here in your local community. If you do have a wound or you think that you might need to be seen in the wound clinic, please either talk to your primary care provider or just self-refer to the wound clinic. We will provide the number in the caption and on the screen so that you have full access to all of the resources that you need for wound healing. Thank you so much for joining us. We hope to see you again very soon, and until we do, remember, rural health strong.